Well, if you thought Medicare Advantage was free, you've been lied to. Today, we're going to uncover the marketing tactics that they use to lure people in with false promises, always saying things are absolutely free, and what you need to know if you're going to make such a decision. Hi, my name is Christopher Westfall. Been helping people with Medicare for 25 years now, and it never ceases to amaze me what they're doing these days to come up with tactics to lure people away from their original Medicare that they've earned their entire lives. Let's look at a few of them. See, the problem with Medicare Advantage is they're paid by the federal government to give you benefits, and what they end up doing is actually giving you little freebies. Like they'll say you're going to have a free dental card, you're going to have free vision, you're going to have all these amazing perks. What they didn't tell you is what happens to the major medical health care that you actually deserve and you thought you were getting with your original Medicare. So you trade in your original Medicare when you get on Medicare Advantage, and that's the part people don't know. This is a little mailer to show my point. This was pulled out by the U.S. Senate, the Finance Committee, when they did an investigation into deceptive marketing with Medicare Advantage. And you'll note on here it's talking about up to $3,000 in dental services. Oh, you can go to the dentist of your choice. That's no longer true. And then you can see the other part here, up to $1,200 in over-the-counter annual allowance. Up to $600. Now, if you look at the very small print, it'll say that this information is depending on where you live, and they might have one zip code in the entire country that has any one of these events, these things that they can give away for you, but it's not everywhere, and it's very, very deceptive, and that's why they included it. Here's another one. You can have money back in your Social Security check, 0 to low monthly premiums, 0 or low co-payments. Benefits may vary by plan, and then free over-the-counter health items, a free flex card for dental, vision, and hearing. But the question must be asked, if all these things are free, then what do you actually have to give up? Oh, here's another one, very popular out there. They spend millions of dollars on marketing. Call the Medicare Coverage Hotline, and you can get rides to your appointments. You can get private aides in your house to help you. How amazing is that? And free dental and vision, there it is. Prescription drug coverage included, even home delivered meals. But these may be limited in limited service areas. Some plans may offer health food. Some plans may do all the small print that most people don't pay attention to. And then, of course, everyone knows our friend Joe Namath and what he's been touting for years and years about get all these benefits that you deserve. Well, just today, as a matter of fact, there was a video on YouTube TV, which is where I watch my TV. And let's pay attention to this commercial. Again, this is brand new in 2025, and see what you can pick up.
Getting the benefits you want? Are you spending more than you need to? We know finding the answers can get confusing, but we made it easy for you. It all starts with one call to Reliance, where you'll be connected to a licensed insurance agent ready to help. So make the call today at 877-510-7705. The licensed insurance agents we work with are Medicare Advantage specialists.
Oh, they're Medicare Advantage specialists. Well, if I'm turning 65, I'm brand new to Medicare, why wouldn't you want to show me all the different plans that I could be getting? You're only going to talk about Medicare Advantage. And if you've been through this process, if you've been turning 65, you've gone through and you've seen the stacks and stacks of mail that they send you for kindling wood for your fireplace, you'll know that 99% of the agents are only telling you about Medicare Advantage. Why is that? I'll show you in just a minute. Let's continue. Medicare Advantage only.
They completed a 40-hour licensing course.
Oh no,
passed
40
their state
hours.
Insurance exam and receive ongoing
Well, they've got to have all the experience in the world with a 40-hour course. Come on.
insurance certification training. They can help explain the difference between original Medicare and convenient Medicare Advantage plans.
Convenient. We're going to only talk about Medicare Advantage, folks.
Which offer all of the benefits of original Medicare, plus
And there it is, the big lie. It offers all the benefits of original Medicare. Is that true? You'll hear from some expert witnesses here in just a second that say that's absolutely not true. But that's the lie that every agent out there that's pushing only Medicare Advantage says. You're going to get everything plus more. Not that you're going to give up everything and go to a plan that has all kinds of restrictions, but I digress.
additional benefits you may want. They also know the changes to Medicare Advantage plans year by year.
Why would they need to talk about changes to Medicare Advantage plans? Because they change absolutely every single year. Here's a Senate investigation talking about those little freebies that we talked about. Here's a person from the Department of Insurance.
Enroll in Medicare coverage for the first time. They meet with a broker or see an advertisement about Medicare Advantage plans offering $0 premiums and boundless supplemental benefits. Sounds good, sometimes too good to be true. Are advertisements like this misleading? And if they are, what should federal government, what should we be doing about it?
They are, and this has gone on for years. On all of our public presentations and our counseling, we beg the consumers, do not choose your health, your prescription drug coverage based on an advertisement. The advertisements will focus on the zero premium, zero copay at a primary care, maybe no copay for generic medication. But we really want them to look at things like, what is the copay for inpatient hospitalization per day? And when it comes to Medicare Advantage, also know that maximum out of pocket, which would be a limit to their financial risk. So the advertisements over the years have gotten more aggressive, and they do focus on those added benefits, specifically cash allowances, debit cards, money to go into the local drugstore and purchase items that aren't covered. And we have counseled numerous individuals, especially over the past open enrollment year. They were very upset with us because we could not use Medicare's Plan Finder tool to order the plans in order of the highest debit card to the lowest. And when we try to circle back to things like their specific providers, mental health needs, and other critically needed services, they really want to focus on those added benefits. And that has been a challenge for us due to the advertisements.
The advertisements say you're going to get all this amazing stuff, and they never talk about the most important thing. How am I going to access my care? And have you been the recipient of dozens, if not hundreds of calls in 1 week from agents or telemarketers trying to get you to get a phone call with them so they can sell you Medicare Advantage? That's what it all is just Medicare Advantage.
Are sick of all the calls coming in on it.
If I may, our seniors are sick of it too. When we are at public events, they approach us afterward with their phone saying, how do I make it stop? And we ask them, they're on the do not call list. That's not enough. And Ohio also is home to, I think, over 250,000 independent agents that want to do right by their consumers. And that's not where these calls are generated from. It's often the lead agencies and these third parties. And I believe if the plans were held accountable for the actions of those middlemen, those entities, it might curb some of those calls.
Okay. What would that accountability look like?
I think punishments for the plans, whether it impacts their star rating on the Medicare tool or financial penalties, that would be determined up above.
That would be determined up above. Nothing is happening to the Medicare Advantage companies for this junk. Nothing. They haven't come down from up above and punished anybody with it yet. So the Senate, this is a different one than I've covered before. This was the Senate Finance Committee, and they wanted to gather all these deceptive marketing pieces. And then they went to CMS and said, you need to change things. They tweaked just a little bit, but not much, because the fact is they're still doing the same stuff they were doing before. And here's something that you don't very often hear. What happens with Medicare Advantage? Let's say you give up your original Medicare and you go over to Medicare Advantage. By the way, if you're wondering what the difference is, here it is right here. Let me show you on the big screen. Original Medicare is what you paid into your whole entire life. Your whole life with your FICA taxes, you've paid for the benefit and the privilege of having original Medicare. But that's not where the money is for us, the insurance agents. Oh no. Medicare Advantage is where you give up your original Medicare and you don't have the freedom and flexibility to go to almost any doctor in the entire country in any healthcare facility. Oh no, you've got limited networks. You've got doctors and providers who are in the plan's network you can go to, and you have to stay in their service area. And some plans won't even cover services outside the service area at all. And you have to stay in their network, which can change any month of the year. and you probably need a referral to go to a specialist, and you need prior authorization before you can have anything done. What does that mean? Prior authorization is what doctors absolutely hate. Means they have to get permission to treat you. They already know what it is that you need. And so they have to get the insurance company, medical director, somebody in there to give them permission to have the treatment that they know that you need. Oh, by the way, is that the same thing with original Medicare? Nope. There is no prior authorization. There are no referrals required, and there are no networks. But original Medicare in and of itself, and this is what the agents will tell you, it's not good enough because original Medicare only covers 80% of everything you need to have done. That's under the Part B. That's the outpatient things. It's only going to cover 80%. You like my handwriting? So what do? You can get a Medigap, otherwise known as a Medicare supplement, to plug those holes. Then you have full comprehensive care. If you have a Medicare Advantage plan, let's not even talk about the services that are denied routinely, which you'll hear about in just a second. Let's not hear about what they're doing to hospitals and the prior authorization and all that. Let's just say that they do absolutely everything by the book, and they treat you as if you were on original Medicare. They give you all the inpatient coverage, which, by the way, pay close attention to that cost on the inpatient care with Medicare Advantage. Most people just don't even think about it until they go in the hospital. You'll hear one of those stories in just a second. But with original Medicare, they're going to cover 100% of all your cancer costs when you've got a Medicare supplement. You can go to MD Anderson. You can go to the Mayo Clinic. You can go to Johns Hopkins. You can go anywhere in the country for the best possible cancer treatment. Is that the same with Medicare Advantage? Absolutely not. If you think that cancer is prevalent in the senior community once you turn 65, you'd be absolutely right. It's devastating in that community. Only for more than 50% of seniors who've joined Medicare Advantage, then they find out how limited the scope is on the treatment options available for cancer. Then let's just give them the benefit of the doubt. Let's say that they approve your cancer treatment. Right off the bat, cancer is not growing anymore. You didn't have to wait for any tests or treatment through prior authorization. Let's just say it's a perfect world, and they guarantee they're going to cover all your cancer treatment. Guess what they leave you with? 20% of the bill. But wait a minute, I gave up my original Medicare so I can have a private plan, Medicare Advantage, and it's supposed to cover everything just like original Medicare. That's right on cancer, because original Medicare only covers 80%. So Medicare Advantage said, well, if original Medicare only covers 80%, then we're going to have prior authorization, restrictions, network limitations, and denials of care routinely. But if you get through all that, they're only going to cover 80% of the care. And they'll say, but you've got to max out of pocket. So you can only spend $6,000, $7,000, $8,000, $9,000, and then you're cut off from paying any more until the end of the calendar year. So how many seniors out there, let me ask you and put this in the comments, how many of you have $10,000 sitting around for your diagnosis of cancer to then have all the other hurdles that you have to jump through just to get your benefits to pay 80% of it? So that's why I'm bringing this to your attention. If you have a Medicare Advantage plan, which lots of people do, 23 million people, they have Medicare Advantage. You really, really, really should look into getting cancer insurance coverage. It's very cheap, very inexpensive, but it's an indemnity policy, which means you can use it at any provider. So if your Medicare Advantage company says, we're not going to let you go to that treatment facility, you can say, forget you, I've got cash now, $25,000, $50,000 on a cancer plan. I'm going to get the best treatment possible. Or even if you don't, you're going to go through all the litany of restrictions that they have, at least you'll have the money for all the copays because you're responsible for 20% of all the costs on cancer treatment. The other one is hospital indemnity. We'll hear a story about a lady who couldn't even afford the $300 per day to go in the hospital. That's why these hospital indemnity policies, which are very, very inexpensive, it could be $20 per month, but they can help you with those massive bills that you could get on a Medicare Advantage plan and make sure you go to the right facility and make sure everything's authorized ahead of time. Medicare Advantage, though, this is a little known secret. This is where the money is for the agents. It's in the Medicare Advantage. And that's why all the advertisements, all the commercials, all the direct mail, all the telemarketing is geared toward Medicare Advantage. But here's another aspect of it that you probably have never heard. What is it doing to hospitals? Because they pay less than original Medicare to doctors, they're all capitated, to hospitals, to providers, and all the rest. So what happens to these hospitals? You should see this.
And this takes a little bit off topic on this, but the issue with some of my rural hospitals especially, they're getting more and more frustrated with the denials that happen. Just an automatic, it's going to be denied. So trying to get the pre-authorization in process so that they're not going to have denials, or to be able to have a predictability in the process.
Now, with our NBC News investigation into Medicare Advantage, those Medicare-approved plans offered by private companies. Millions use them, but we found they routinely reject claims for necessary care. As Sam Brock reports, it's devastating hospitals in rural America.
What we're seeing is literally in my state, we have some hospitals now that just won't take Medicare Advantage, period. They just cut everybody off and said we can't do it because we can't afford the constant chasing for all the denials. So that is exactly the opposite of what we want to be able to create here. What are you hearing on that, and what are alternatives that you would see?
It is absolutely imperative, right, that our seniors can get in for care when they need it, and that we're not putting up unnecessary barriers to necessary care. This is a priority for us to make sure that we're partnering, particularly in those rural areas where there's not a lot of options, so that our seniors can get in for care when they need it.
Okay, thank you.
That's a politician answer to a politician. She did it pretty good. It's very important to us. Yes, we're denying care on a routine basis, but it's important to us in the Medicare Advantage world. It's very important. It's very important.
Partnering,
we're partnering. It's important. We're hoping to do it. That's called upspeak. And it's usually when people are grasping for truth.
Particularly in those rural areas where there's not a lot of options, so that our seniors can get in for care when they need it.
Okay, thank you.
How dire is the situation when it comes to rural hospitals?
More than 300 hospitals that are at immediate risk of closure, and another 300 that could be at risk of closing in the next 6 to 7 years.
When Rose Stone retired, she signed up for a Medicare Advantage plan.
Rose, how long have you been coming to Dr. Williams' clinic for?
20 plus years.
And did you think if you signed up for Medicare Advantage, you'd be able to continue to do that?
At first, I did.
She was later surprised to learn the plan didn't cover her visits. Faced with paying out of pocket, she made a difficult choice.
I had to stop coming to Williams' clinic.
An advocacy group for Advantage plans tells NBC News they acknowledge the challenges facing some health systems, but we need to ensure coverage is maintained for millions of seniors. Rose has since gotten rid of her Advantage plan and is seeing Dr. Williams again.
You felt like you were taken advantage of.
I know I was. Yeah, I know I was.
Sam Brock, NBC News.
Yeah, she knows she was taken advantage of, but some agent made some massive commission by putting her on a Medicare Advantage plan for the first time. I can guarantee you that. If you've not yet done so, please subscribe to this channel. And please, if you know anybody who's going to face the decision, what do I do when I'm turning 65? Or I'm leaving my employer plan. I've been there my whole life. Now I'm getting rid of my group coverage and I need to go on Medicare. Which way do I go? Because 99% of all the advertising they're going to see is just based on one thing, Medicare Advantage. And they'll never even hear to be able to make the choice that something else is available. So please make them a subscriber to this channel. Send this link right there, seniorssavingsnetwork.org/YouTube. If you go there, you automatically can subscribe to the channel. So when things change, and boy, they're a-changing with Medicare, if you hadn't heard in the news, a lot of things are coming up and changing with Medicare you really should stay apprised of. My goodness. So here's some solution for you. We're going to go into a deep dive on this hospital situation because a lot of that has just recently been worsened. But here's some things you can do. With Medicare Advantage, a lot of people feel like they fell in the black hole. When things go wrong, they really go wrong. And it's great coverage if you don't need it. If you just need to check a box and say, hey, honey, I got my health insurance covered. We're good to go. We got 0 monthly premiums, or we're even getting a kickback from Part B because that company made so much money from the federal government on us. They're giving us some of that money back. We're getting a Part B give back, which is still available in some parts of the country. It's fantastic, right? What are they scraping on the other side as far as your benefits? You'll only find out when and if, God forbid, you actually have something where you need real coverage. So here are two things you can do. We talked about them: cancer coverage and hospital indemnity coverage. If you're on Medicare Advantage, you should really check out this website called CompleteMyPlan.com. Yes, my office helps people with Medicare Advantage, but we're going to do it with full disclosure and transparency so that you know what you're getting into and what you're giving up, more importantly. But if you make that value-based decision that you're not going to have original Medicare, you're going to give it up, you're not going to have a Medicare supplement to plug those holes and have no restrictions on where you're going, nobody telling you what you can and cannot have done, and nobody telling you where you can and cannot have your cancer treatment, if, God forbid, that happens to you. Let's say you give all that up because you can't afford a Medicare supplement at this point in life. Then when you get on the Medicare Advantage plan, you need a strong advocate to look out for you and make sure you're not getting screwed. Sorry, that's the truth. And every year, the Medicare Advantage plans do change. They change drastically. The networks change, the benefits change, the policies change, the hospital copays change, the drugs, the formulary, all the Medicare Advantage little parts, they change every single year. What most agents won't tell you is if you were on original Medicare with a Medicare supplement plan, one of the plan letters, Plan F, Plan G, Plan N, etc., those plans never change. Somebody who bought a Plan J in 1972 still has the original benefits of Plan J. Somebody bought a Plan F in 1985. I have clients that are that old and they still have the exact same benefits today if they have the same plan. Never change because there's no network. Isn't that easy? If you have a Medicare Advantage plan, please consider going to this website and finding out about those options so you can plug the holes that are prevalent on Medicare Advantage. Now, in a second, we're going to do a deep dive into what's really come out about hospitals lately and what's going on with it. And this is something you really need to know because it's not just affecting you. It's not just affecting your neighbor or your spouse. When it comes to Medicare Advantage, it's really impacting and shutting down these hospitals around the country because they're just not getting paid. Forget when they deny you coverage, which is routine, triggered by artificial intelligence. But let's say that you did get the coverage, you got the treatment done, then the hospitals are having a hard time getting paid. The Advantage companies, I guarantee you, are paid like clockwork from the U.S. Treasury. Your taxpayer money is paying them in their pocket a lot of money and paid the agent who signed you up for it. But why are the hospitals not getting paid? So if we can help you in any way, shape, or form, or someone you know that's making a Medicare choice, please have them reach out. Our contact information is right here. It's 800-729-9590, or the easier way is to go to the website where you can literally book an appointment that's convenient for you. So one of our expert agents can actually help you and go through what the choices are. And they're going to show you everything. They're not going to keep something behind them and only show you the most high commission products that are out there. So if you'd like this kind of help, we're here for you. If you'd like to access the reports, the new articles that we were talking about today, the Pradon report, the Senate hearing, the investigation, the American Hospital Association letter, talking about all this stuff that's been going on lately, you can access that in the description of this video below, as well as timestamps part where you can go back to seeing different parts of this if you want to share that with other people. We're here to help you. Please comment below on this video. Please like this video so other people can find it in the algorithm, and we'll continue doing our very best to help people with their Medicare and in the confusion that often comes when they have this critical decision to make. I'm Chris Westfall. Thanks so much for watching. God bless you. Bye-bye.